Hello. This is beautiful. Thanks. This looks really nice.
Thanks.
I'm vlogging. You're on film. Yeah.
Great.
This is awesome. This is so cool.
Thanks.
I like the appointment only sign.
Yeah, I don't.
Get out.
I don't want any of stuff coming in. I can't. Yeah.
This is so awesome.
Yeah,
You look great.
Thanks.
Nice to see you.
Nice to see you.
You've lost a lot of weight.
Fasting.
Like a lot.
So we got 4 rooms.
This is badass.
Yeah. 4 rooms. This is the main one, and then just some. We even got like a nice bathroom too.
Yeah.
So it's weird. People.
Yeah. Oh, did you not have a bathroom in the other one? Or you had to go upstairs or something like that?
Walls, yeah.
This is cool.
Come on in.
Okay.
What's happening?
I feel really well. Okay. Last time we met, we talked about like taking a serious deload, and I did. Like I started back up again. Okay. But the past like 3 months, I've been training like 2 or 3 times a week. Yeah. And it's felt great. Like
I try to like
rested.
Tell people it's more of that quality than quantity. People just think they got a hammer, but then you don't get to that recovery.
My body was just beat up. Like I needed some rest. So I moved to just doing like very simple metcons. Okay. And I squatted like once every couple of weeks and stuff like that. I feel great though, but now I'm getting back to lifting more consistently. Mm-hmm. But it's still lower volume. Like I have a couple squat days, I have lunges, stuff like that, but I'm not doing that with metcons. Okay. So I just want to build my strength back up again, but make sure I'm staying super healthy while I do so.
Okay. You had any symptoms?
No, I mean nothing.
Okay.
I feel really well. Good. But I want to stay that way.
Yeah. Let's let's just see, because usually for me, if a test is limited, it won't present until a couple months on the road. That's why I've been really trying to focus with more people on preventative stuff, like, hey, get these tests clean and then you're good. Yeah. Because what happens is by the time someone gets a symptom, it's already been going out for a long time. So let's measure that. Yeah, go up on all 4s and let's measure what we got here. Roll this up.
Mm-hmm. Does Brian have one of the offices? That's what he was talking about?
Yeah.
Okay.
If he gets his shit in gear. Sit down in front of me. And then come up. Any pain with that?
No.
Let's see if it's flat at all. Wow, it's actually pretty good. Is your camera on?
Yeah.
We'll get up close. What are you doing?
See, this is why you go see Dr. Maggio, because he does measurable.
Yeah, we don't throw tape. We don't throw tape on shit. So this is actually pretty good range of motion. So the pencil test is a really good test to see how your back is bending. Your back has to bend fully to accomplish a lot. So you can see up high here how the pencil's way off. This is good. Down here, a little more flat in there. But we know Nicole's got a little bit of disc stuff going on in there. So the key for us is to kind of keep that tissue as clean as possible. So what we're gonna work today is there's a ligament on the top, and then we're gonna work some of that fascia down through there too. Let's see what we got. Here we go. So, we have the instrument, and me and Nicole like to talk about fascia. And I think fascia is very, very important.
You're gonna draw? We should do a diagram. So what is the difference between fascia and the muscle?
Okay.
What are the functions?
So, fascia is very important. I kind of think of fascia as like...
Make sure you're on film. Just keep talking.
Okay. Mm-hmm. I think of fascia as like the saran wrap of the muscles. Like it keeps things nice and tight. Mm-hmm. And usually what happens is it gets bound up and stuck to other muscles. Mm-hmm. So areas where I find a lot of benefit from fascia treatment is like in the lower part of the spine, like down in the lumbar and all the way up through the thoracic spine. And especially down like in the foot too, like the fascia in the foot and everything like that. What happens is the fascia just doesn't get a good blood flow and oxygen and everything like that. So yes, I do believe that the fascia is a component to an injury. I don't think it's the smoking gun for an injury where there are some schools of thought out there, if you get the fascia moving, everything's going to be good, which is, it's part of the equation. But for me, what I find is the fascia is the first roadblock for me. When if I'm trying to work some of the deeper muscles on the spine, if the fascia is bad, I can't get there. So what I'm able to do is get in there with a special instrument and break down that fascia. What I find is that with some fascia treatments, it's almost too aggressive when they do promote some bruising and some of that, which, you know, we've been kind of this idea that we create some havoc to do that, you know, create that inflammation and pain like that. My thing is if you can get away with not having to get that damage in there, because there's a lot of collateral damage in there. Like, one thing I can't stand is Graston. Like, Graston is like the main tissue fascia treatment.
No, they use instruments, right? Like they...
Yeah, the problem with Graston is it was really cool when it came out like 30 years ago. It was revolutionary, but they tried to do this where they applied Graston everywhere, as opposed to like certain rules. So the instrument that we have in the way the system is taught is there's certain rules to treat the muscle or the fascia. It has to be less than an inch of depth. There can't be a lot of blood vessels and nerves, and the tissue actually has to go parallel. So you go with the lymphatic flow of that. Where Graston is kind of just haphazard. They just go in and scrape a bunch of stuff and see what happens. And they're putting it in some really bad places like the armpit, the groin, and then they're just blasting away on stuff. So they're basically, I say, like a blitzkrieg. Like they just do a bunch of stuff and see what happens.
Like, that hurts, let's scrape it.
Yeah, and people are like, oh, it hurt like hell when I did it and it bruised, so I must be doing something right. But that's not the case. You don't have to do all that damage to the tissue. So the other component, you know, and Nicole's helped me kind of understand that too, is, you know, the role of like just fat deposits getting stuck in fascia and things like that, and removing that. And I think that's some cool stuff that I've seen in order from there.
Yeah, it's fascinating. I don't think people have paid enough attention to fascia. I mean, I'm learning more about it too.
Yeah.
I think that it has a bigger role in the body than we've given it credit for.
Yeah, for sure. And I definitely agree with that. And I actually, for my deep thought of the day, I did a video that talked about the difference between maintenance versus treatment.
Right.
And that's where people get mixed up. You know, K-Star out there tells everyone they have the ability to maintain their body.
Sure.
And if you actually break that down, he's right. You can maintain your body. And what is maintenance? Keeping the fascia clean.
Right.
Foam rolling, stretching, eating right, a little bit of massage every once in a while. That's like brushing your teeth.
Okay.
But what happens is people go to those tools after they've been injured.
Right.
So I end up seeing people if it's an acute injury, those things will be great. I actually don't even like to treat acute injuries because there's nothing I can do until it settles. So I work more of that chronic aspect of an injury because but then what happens is people try to go to that self-treatment, but it's maintenance, and it's like trying to brush your teeth when you have a cavity. You ain't going to fix the cavity.
Yeah,
so
that's true.
That's where my qualms I get with people out there promoting self-treatment, which is I want people to kind of stay in their lane. Like, here's what it can do, but then what happens is people try to reach a little bit more and try to make it this umbrella of everything. Whereas if healthcare and musculoskeletal would be so much better if everyone just respected their part in there. So,
well, and like the hierarchy of things too. Like we've talked about, you know, all right, so you treat the tissue and then, you know, your injury is gone essentially, but it's like, but then you don't address the movement part of it, you know, so it's like what got you there in the first place.
Yeah, and I always say there's an order of operations to fix some things, and first is you just got to get to someone that can kind of get you back to baseline, restoring normal range. But what happens for me is people think when they do treatment and then once it's back and they don't feel bad anymore, they think they're done, and then they don't put the work in, and then they're right back here 4 or 5 months later because they go right back to that activity. So what I always tell people is each doctor, there's never just one doctor or one person that's going to fix your problem. It needs to be a team of people. But what happens is people need to wait in line for their turn. So in my clinic, and what I do and what I see is I'm the early guy. I'm the guy that comes in, breaks down all the junk, gets everything out with my hands and an instrument, and restores normal range. Then you want to bring in someone that's going to address the imbalances that are in there. You know,
so not physical therapy first.
Everyone always jumps to physical therapy. Like they're like, oh, and it blows my mind because people are like, we've just been accustomed to this idea. If something's tight, we stretch the hell out of it. If it's weak, we need to strengthen it. But or then it gets to like, oh, my glutes aren't firing, or this isn't working right. It's like your body is complex and it's trying to avoid those things. It's your glute isn't firing for a reason because of that. So then you turn it back on and you go from there. So trying to do an exercise before you fix the range of motion is like trying to put the roof on your house before the foundation.
Right.
So the problem is everyone thinks they're an expert, and with the internet and being what it is, and it's dangerous because I understand people are gonna try their best to try to fix their injuries themselves, but the real danger is if you have some type of major pathology like
me, like disc issues.
Yeah, like a disc issue or a tear in the cartilage. By doing those maintenance things or trying to treat it, all you're doing is just raising what's called your threshold for where you see the pain.
Sure.
But
so you feel better like a couple hours afterwards.
Yeah, it's like with cortisone and kinesio tape. So what I've gotten better at is trying to respect other professions.
They'll have their roles. But
everyone has their role, and I wish everyone would just line up and do it right. And I know that I'm not good at exercise and things like that, but I'm really good at fixing the tissue. Right. But if you just jump to exercise and don't fix the tissue, you're not going to get anywhere. Yeah, so what I wanted to kind of see was how I do fascia treatment. So fascia treatment doesn't need to be as aggressive as people think.
Right. Because I've been bruising.
Yeah.
You know, and Ashley's concept is, okay, well, there's healing bruising, right? There's blood flow to the area. You need, to pump in the good and get out the bad. But how much is too much? Like, are you damaging? Is it necessary?
That's like that collateral damage they talk about. Like, you're doing bruising, but my thing is like, what are we doing bruising in context to? You know. So what I've read a lot of Ashley's research, and I think she's done a great job of educating and getting it out there to the masses. Yeah. My only issue that I ever see with it is the musculoskeletal component of it. Yes, fascia being healthy is important. Yeah. But there's certain it's not the fix all of everything. Yeah, I think it has a very good. I think what she's doing with the cellulite and all that is awesome. Yeah. But then it gets a little dangerous when you give someone that wants to try to treat something. Right. That's the word, treat versus maintain. If you're injured and you're trying to use these things for it, that's different. And that's where people don't understand the difference between an injury or just basic, like you're stiff and sore, like recovery. Right. And that's what I want people to be more informed of is those things go out the window once you're fully injured. And those are usually people that when people come into my clinic, they've already been dealing with
too late. Yeah.
6 to 8 months of it. They've tried all of that stuff.
And then they went to their chiropractic insurance and they did
and everyone, and honestly, the musculoskeletal world just sucks. Doctors they're not trained in figuring out what's wrong. They just want to mold your treatment to whatever they're trained in, as opposed to what you actually need. And the people that suffer the most are the people who are injured, and then what happens is it gets delayed, and then they have no choice, and I gotta send them to the orthopedic doctor, and that sucks. I'm seeing way too many younger people that are having blown out discs and stuff like that. So I think if everyone just kind of stayed in their lane and benefited from each other, like you said, I'm trying to focus less on bashing people as a more to understanding what they have to offer and how it can help my patients versus what I can do to help their people. But I think if everyone just respected each other better instead of coming across as a bashing thing, I think more things would get done. But unfortunately, in the space out there, who's ever the loudest and screams the most, even if they don't have any real training or knowledge, they get listened because we are a very short attention society, which is bad. But at the same time, there are people out there like me that can accurately diagnose and fix the problem and then help you keep it fixed, They
need to respect the hierarchy.
Yes.
Right?
Yes. Okay. So let's work some fascia.
All right. Working fascia.
So we're going to go up on...
and is there fascia all around the whole, spinal column?
If you look, actually... Here, we'll bring the camera over. You can actually see it. Pretty good. So down here, in the white area here, is what's called the thoracolumbar fascia. Okay. And it goes up through here. And basically you have all your muscles in your back and they are surrounded. I mean, that fascia goes all the way over there. Right. And usually this is just a wreck on people when I get in there and work, especially my low back people. Yeah, so let's just get in there and see.
Right. And so with your treatments, you're talking about different treatments, you have to break through layer by layer. That's why, you can't say, oh, it's only going to take 6 visits, or, it's like you won't know until you start peeling back the onion.
Yeah, exactly. I tell patients the onion analogy works awesome because we're peeling back layers in through
Right.
there. But what happens is we don't know. It's kind of like gutting a bad house, and you start pulling stuff up, and you don't even know.
Right.
So we'll work this fascia first.
Okay. Peel the onion.
Onions of dysfunction. So we'll put a little lotion here.
Okay.
The first thing we're going to work is called the supraspinous ligament. It's on top of the spine here. So Nicole's just going to hold it at the top. And then what you're going to feel is a little bit of gritty in here, but nothing bad. Right down through there. And
Sounds horrible.
Yeah.
So you don't want it to be gritty.
No, you want it to be nice and smooth.
And mine's not smooth right now.
But you're feeling better, which is great because you're below, you don't have as much dysfunction.
Right.
Up a little more. So you're below symptom threshold, but what happens is early intervention on this, like if I look at a test and I can see it bad before it becomes symptomatic, we can clear it out in a couple visits, you know, and a lot of medicine is not preventative, but if you get on it early enough, it really helps. And that is jammed up in there. Up a little more. There we go.
I can hear it.
Yeah, it's pretty nasty in there. There we go.
So for something like Graston, would someone just scrape it away?
Yeah, it's just a bunch of, it's like a 2-year-old scribbling.
Right.
So we worked the first part here on the ligament, and you can see, got a little red, but nothing too bad. And the beauty of this instrument is it creates a little thing called petechiae, which is some blood vessels going, and it lets me know it needs treatment, but then I know to stop.
Right. So that red coming through, that would indicate what? That
there's a blood flow rush there. It also indicates there's a lot of adhesion in there, too.
Okay.
So the next thing we're going to work is actually the fascia itself. So this one, you're going to sit back in child's pose.
Okay.
And then I want you to go all the way down. Nicole doesn't do a ton of yoga. So we're going to work the fascia itself and see what we can feel. And, the treatment should be a little uncomfortable, but nothing like, oh my God, what is he doing to me?
Right.
Oops. If it's excruciating, they're just making it worse. So we'll start down here.
So what about people that are like, oh, I'll just go get a massage, like massage therapy,
Massage is really good if you want to relax. Or
like a maintenance, like
it's like brushing your teeth. Right? But if you're going there for an injury and you're like, well, this is they're not. They don't have the training. They went to school for 6 months, which is fine, but they're not specific. And then, you get these ones that say, oh, I'm a sports massage or whatever. It's just nonsense.
So they're not diagnosing you. They're just, you're saying, hey, my neck hurts. So they're like, oh, I'll just massage your traps.
Yeah, and that's that whole idea, like we said, maintenance versus, and this is really gritty in here.
Yeah, I can hear it.
Doing okay?
Yeah, fine.
Plus, you don't need a ton of treatment.
Right.
People think, I go to an hour for a massage, I'm good.
Right.
But for me, my treatments are 10 minutes because we know where to go, and that's all the body needs. Now you got 50 minutes to go back and do whatever the hell else you want.
Right.
I joke with patients and say, a lot of them come over during lunch and I think they don't want to go back to work, so they want to hang out or,
But it's effective. That's the thing. It's targeted. You're not just...
Yeah. We're not just doing treatment to do treatment.
Right.
And this is real gritty in here.
Wow, that sounds horrible.
Yeah, it's not great.
Yeah.
Right there.
Yeah, so, there's really no way to do this on yourself either. Like that.
No, you can't.
You can't.
Yeah.
You wouldn't want to.
I had someone I posted the other day about that, and someone said that they could treat their deep muscles in their neck with the fascial blaster. And,
no.
that's when I kind of draw the line for me. But that's where people, it's the same stuff with like vitamins and herbs. Like they're safe in a certain way, but there's always some jackass out there that takes extra, and ruins it for everyone else.
Yeah.
And that is really bad in here.
Right, so I really need to see you.
Yeah.
See, but the thing is, I'm not having any pain or symptoms right now. So this is catching things early, making sure it doesn't get to that bad point where I do have pain.
So we are done with that. So come back up for me. And then you can see right here, she's got a little red, especially over through here and over through here, but nothing too bad. And that's all it needs.
Yeah.
You know, we know the key is knowing when to stop.
Right.
So let's recheck that test. I'm always curious to see. Scoot back just a little bit. So sink down for me and then come up. Do that for me. Now what we're seeing is, you see now both ends of that pencil are really off. So she's getting full movement in there. Before it was dipped down a little bit like that, but now it's like a teeter-totter on both sides. That's fully bending spine, and that's good function. So stand up for me. The importance is, people don't realize is your spine has to bend fully. If it doesn't, any limited motion you have in the spine
Right.
just crams on your disc. So you have a disc injury, you can't get away with having
Right.
decreased range, because all that does is just compress it more. So
Yeah.
getting things clean and going from there, and you can even say, you know, it's not bad when we treat it, but
Yeah.
we know when to stop. So the bruising part for me, it shouldn't always bruise. It might bruise a little bit, but
Right.
if you're getting a ton of bruising over time,
Yeah.
then you're actually just damaging healthy tissue.
Yeah.
So
Okay. And then I've had some treatments where, like, you kind of get detox symptoms a little bit. Like sometimes I'll feel like worse before I get better. You're like, well, you didn't realize how bad it was.
yeah, so what happens in what I see in my office is we treat what's called adhesion. It's like
Yeah.
glue that gets inside the muscle.
Right.
What doesn't, now the muscle doesn't get good blood flow and oxygen.
Right.
So what happens is the waste product builds up too. So getting in there and cleaning up that
Yeah.
actually releases a lot of waste product. So a lot of people will say with my treatments, you know, it takes 2 or 3 days before you actually
Right.
feel better. But we live in such an instant gratification society.
Right.
Like if it doesn't feel good right away, we didn't
Yeah, it doesn't
do
work.
anything. But sometimes you got to work some dysfunctional tissue to get better.
Yeah. Wow, that's awesome.
Yeah.
I mean, it felt like I didn't know it was that bad, but you wouldn't know.
You wouldn't know until you go in, you know, and honestly, people don't know. But what I say is, when you get a symptom or pain, don't ignore it. You know, like don't do treatments that work around that, like cortisone shots or kinesio tape. Like
Yeah.
those treatments blow my mind because they're not fixing anything.
Right.
They just make you not notice the pain.
Right.
Pain is your body's way of telling you something's wrong. So,
Yeah.
awesome.
Awesome. Thank you. It feels good.
Good.
All right. Healthy discs.
Healthy discs. Like she is.
No. So what?
The really fucked up part about orthos is they know that cortisone is garbage.
Yeah.
The research has been out there for years. Like cortisone might block a little bit of pain and maybe help with a little inflammation, but it routinely degenerates the tissue.
Oh, really?
Crazy. Like it does a really good job of getting rid of inflammation, but it degenerates the tissue. 97% of tears were injected with cortisone multiple times before.
Right. Over and over again.
What I think, and this is just me being a conspiracy theory, but whatever, you know, these orthos know that it's going to fuck people up.
Yeah.
But
And you're going to be on the table.
What happens on the back end? They have to do surgery, and you know, you're a really shitty person if you feel that way and you think that way. But unfortunately, that's how it is. I know there's good doctors out there, but for every good ortho, there's like 10 shitty ones.
Well, like even the cortisone alone being bad for the tissue, but like you said, it just shuts off that signal. So you're
fix anything.
So people know, that doctor knows that they're going to be feeling well and thinking that they're able to go back to doing what they're doing, knowing damn well they shouldn't.
It should be just more an idea of informed consent. Like when patients go in the office, the doctor's like, I'll give you a cortisone shot, you'll feel better. And then it should go, but you will also be having more tears down the road.
This is going to do nothing to fix anything.
6 months, you'll feel good for a few months, but you just kick that can down the road and you're not doing anybody a service. And it's just sad, but at the same time, it's like, it's people's own damn faults.
Yeah.
You know, like,
do some more research.
Yeah, research and stuff. You know, like people, it's even like when they go to like an ortho, they'll get one opinion. I'm like, are you kidding me?
Right.
You know, my grandmother went, and she supposedly needed back surgery. She went to 4 different ones, and everyone told her a different thing. That's freaking scary.
Yeah.
You know what I mean? Like,
yeah, they're all reading the images differently, diagnosing differently.
Yeah, and it's just like the orthopedic world would be so much better if they got paid based off of outcomes.
Right.
So if I did surgery on someone, I'm not going to get paid my money unless I know that they're going to do 50% better. You know what? That would cut the friggin' surgery in half. But we don't. We're in a very instant gratification society, and all we care about is now, and how I'm going to feel now. But you know what? The only thing worse than where things are is where they're going.
Yeah.
People don't know that. So that's my perspective. I try to get to people that cortisone just sucks.
Well, and then I hear from a lot of people, they do have their shoulder surgery or their back surgery, and it's a matter of time before they're getting some other operation.
Yeah, because they never fixed anything.
You know?
They go in and fix the tissue that's bad, but it's
right.
like, well, why is that tissue bad? Because other things aren't working correctly. So fix it conservatively and then see what's left. And you probably don't even need surgery.
Yeah, like address the tissues, address your movement, and then...
Well, the problem, too, is egos.
Yeah.
Egos get in the way, and people just think, hey, they're an orthopedic surgeon, they must know everything.
Right.
One thing that people need to realize, and I realize this, too, and it kind of humanized the orthopedic doctors a little bit for me, they are not good at diagnosing. But they're very good at being technicians.
Right.
So if something's in front of them, they got to take a hip out and put a new hip in, they're great.
Right.
But if you ever ask an ortho for advice, so like where you're not a surgical candidate, they don't know.
Right.
And that's just not in their scope.
Yeah.
But
you listen to them because they're the ortho, so you're like, well, he must know.
6 weeks of PT and multiple injections. And it's like, you know who's fucked the most in the end? You are.
Yeah. Or they own the PT clinics that they're sending you to.
Like, it's dirty. It's dirty. And it sucks, but hey, do your research. That's all I got to say.
Yeah, it's so true.
Now I'm on fire.
Yep, it's good.